Apparently, I'm the chameleon expert. No, I'm not. I'm just the only option. Alright guys, today we have a bonus critter. Today we have a chameleon. Our local pet store brought this chameleon in because he has a rectal prolapse. If you'll take a look back here, you can see the end that's sticking out, and that's a rectal prolapse. Now these happen for a few different reasons. Sometimes it can be constipation, dehydration. Females trying to produce eggs can have these. Parasites can do it as well. They're kind of hard to fix. We're gonna try. We have to anesthetize him and try to slowly push it back in, and then also try to fix the underlying problem that's causing it so it doesn't come back. So stay tuned, and we're gonna try to fix it. All right, so we've got the rectal prolapse reduced again. What we had to do is we had to take a Q-tip with some lube and just kind of gently push it back in. Now I'm going to have to take a suture and put a small suture over the rectum to keep it closed so that it does not come back out. So what I'm doing now is I'm suturing only the top part of it so she can still use the bathroom, but not big enough opening that it can come back out again. It's kind of a delicate process in such a tiny animal, but this is what we're going to try and see how it works. All right guys, we're at our 1 week recheck with our chameleon here. We've been doing exceptionally well. What we did was we put a suture in there just small enough that we can still go to the bathroom through it without having the prolapse. There's been no prolapse. Potty breaks have been doing very well without any complication. We are now going to take the suture out. There is still a small chance that it could prolapse after the suture's removed, and then we have to do some things afterwards. But for now, we're going to take it out and see how she does. Let me tell you guys the importance of a very good veterinary technician. While we were treating this chameleon, the chameleon actually arrested, had no heartbeat, was not breathing, and I gave up on her. Ashley and Heather said that they were not going to give up. They were going to try everything that they could, and they spent over an hour trying to revive this chameleon. Obviously did so after I had written her off and said that there was no heartbeat in there. So that is the importance of a very good veterinary technician. They advocate for their patients, they do what they feel is right, and this is the outcome. Well, since I was not here for this part, I'm going to let Heather and Ashley tell you exactly what they did to save this chameleon's life.
So what we started doing was we immediately got her on our heating pad. We wanted to get her back warm, and we started her on some oxygen to try and help with that. And then we attempted CPR. It took us about at least 30 to 45 minutes to get her back, and then we kept her for an additional 2 to 3 hours monitoring just to see how she would do, and then we sent her back to Petco. We just wanted to give her a chance.
Yeah, we just said we couldn't give up.
We're back with chameleon number 2 today. Apparently, I'm the chameleon expert. No, I'm not. Don't believe that. I promise I'm not. I'm just the only option. This is Arlen. And today, Arlen is a full-grown chameleon. You can see how beautiful he is. But he has a problem. If you can see, he is standing with his neck stretched out, indicating that he cannot breathe very well. Chameleons are very sensitive to their surroundings and their environment. And if their environment is not very particular and precise, you will get issues like this. It's not just chameleons, it's all exotic animals. So you need to really consider this before buying an exotic pet. Now I'll show you the x-ray of what the issue is. So as we can see on the x-ray, there is a little bit of some inflammation in the lungs, but most of the issue is in the upper respiratory tract system. That means the throat, the nasal cavity, anywhere above the lungs has a lot of mucus and inflammation, and it's an upper respiratory tract infection. This is usually solved with an antibiotic fighting off a bacterial infection. So that's what we're going to send him home with. These exotic animals are very particular about what you can and can't use within their diets along with their medications. So we have to be very careful about what we send home with him. and we'll explain that next.
Hey y'all, today I'm going to show you how we take large doses of medicine and how we break it down to where a small animal could take a smaller dose. So I am crushing it in this mortar and pestle, and I have crushed it into a powder. Okay, so I've crushed up the powder and I'm putting it on this little piece of paper so I can put it into the bottle, use it like a funnel. And I'm going to mix it with maple syrup because it will be nice and flavorful for them. So I'm going to dump the medicine into the bottle. Then I'm going to squirt the maple syrup in here. So I got it mixed up. I'm shaking it really good, and I got the lid on, and now it's ready to go.